Hello everyone, welcome to my channel. Today's topic is criteria of nursing. This topic is included in the curriculum of BSc first year, BSc nursing first year, GNM first year, and also BSc nursing fourth year, as it goes in the professional nursing or professional criteria or nurses as a profession. So the note under this can be useful for both BSc nurses and GNMs. Let's start the video. Criteria of nursing. There are numerous criteria of nursing. I have listed some of them. First is socially accepted scientific principles. So nurses use various scientific principles every day while working. Any kind of method, any kind of technique that you use to provide care to the patient should be scientific, scientifically accepted principle, also socially accepted. Socially accepted means you provide that care and patient should accept your care. So socially accepted and scientific principle should be used while providing care. Next is demand pre-professional training. Nursing is a profession in which training is the most important part. Theory is also important, but training is equally important as much as theory. You learn about vital signs. You need to know how to measure vital signs, when to measure vital signs. You learn about bed making. You learn about why bed making is important, why position changing is important. But you need to be trained how to do bed making, what should you use while bed making, how to change the position of the patient, which position is suitable for which kind of disease, after how many hours you should re-change the position in what kind of patient. So you need to have a pre-professional training in order to work as a nurse. Body of specialized training. When we talk about specialty, just know that we are talking about the branches of nursing. In which branches you do your main study, that becomes your specialty. So there are certain special skill that you need to attain if you are belonging to that field. Like if you are a geriatric nurse, you need to know how to communicate with geriatric patient, how to ask what their problem is and how to solve that problem. What intervention do you need to do? Similarly, if you are a gynecology nurse, then you should know how to provide care to a pregnant mother, how to conduct a normal delivery, how to assist in cesarean section, also how to provide care to mother in postpartum phase, mother and baby both in postpartum phase. This is about body of specialized training. Next is evidence of needed skill. When we talk about skill, nursing is all about skill actually. So you need to have a evidence of all the work that you do, of all the skill that you use. The best evidence you can show or you can provide is through documentation. If you document every work that you do, you can use it as a evidence in further continuous work. Next is scientific technique. I have already mentioned above that use of scientific technique is very important when you are working as a nurse, because when the technique that you use is scientific, it is correct. When the mechanics and the movement that you are using towards the patient is scientifically verified, then it is beneficial for the patient. It is beneficial for you also, for nurse also. So any care that you provide, might it be bed making, position changing, oral care, nail care, hair care, anything, there is a scientific rationale. There should be a scientific rationale behind every nursing care that you provide. Next is must follow established code of ethics. There are certain code of ethics that are established by governing body of nurses. They are established by international governing body, also our national governing body. This code of ethics enable nurses to make decisions. It helps the nurses to decide what is wrong and what is right. what to do with the patient and what not to do with the patient. So, following the code of ethics will help you to make sure that your work is ethical. Always follow the code of ethics. These were the criteria. Now, next subtopic is qualities of nursing profession. There are certain qualities that you should possess as a professional working nurse. Here is a list, summarized list about that. First of all, profession applies body of knowledge in practical service. While you are working in hospital, in community, anywhere, nursing home, geriatric home, pediatric care home, anyway, you need to apply body of knowledge while providing care, while communicating, while providing education. You need to apply whatever knowledge you have into the practice. So one of the quality, actually first quality, important quality of nursing profession is that it applies body of knowledge into practical. Next quality is it constantly enlarges body of knowledge. The more we learn about something, the more we find new things about it. In a way, when we are learning about something, we might find problems and we move ahead to solve that problems. So we work, we find problems, we solve problem. That way we are enlarging our body of knowledge. We are making our body of knowledge large. In nursing profession also, many problems arises. Nurses solve that problem. So they constantly enlarge the body of knowledge. Next is professional policy. Policy are established set of rules that we follow as a guideline in our day-to-day work. According to professional policy, we follow everything that our policy makes us follow. So, professional policy also becomes one of the qualities of nursing profession. Next is utilizing practice. The practice that you do as a nurse is utilized by patient, care receiver. You are a caregiver. You practice whatever knowledge you have and care receiver utilizes that practice. Next is educational preparation for entry into practice. Before practicing in clinicals, before practicing in patient, we make you educationally prepared. We make you knowledgeable about each and every topic, minor to minor topic, up to major topic. Teacher teaches you in class, teacher gives you demonstration, and then you are ready to go to the clinical. So that is a educational preparation for entry into practice. Next quality is presence of skill, culture, and values. We are full of skills. Nurses are full of skills, skills of communication, skills of facilitating, skills of providing education, skills of providing critical care, skills of providing maternal, child, geriatric care. So our presence of skill, our culture, nursing culture, the way we work, it might be different from one place to another, but overall, our culture is almost same because our aim is same. Our aim is prevent disease, promote health, and prevent complication. So that is our culture and values among members. Members means among nurses. So next quality becomes presence of skill, culture, and values among members. Thank you so much for watching. This is it for today's video. Topic will be continued in next video. Thank you.